IVM.
Hi, everybody. Just wanted to ask everyone for a quick favor. We're running a brand survey right now and would really appreciate it if you could let us know what you think about the advertising on IVM. Go to ivmpodcast.com/survey and do let us know. As part of this, we'll be selecting 10 random participants and sending them some IVM swag, so do fill out those surveys.
Welcome to All Things Policy, a daily podcast supported by Pragati, a flagship media initiative of the Takshashila institution. We are a bunch of policy nerds based in Bengaluru, and we like to bring fresh perspectives to Indian affairs and an Indian perspective to global affairs. So grab a cup of coffee, sit back, and join us for today's chat.
Hello and welcome to All Things Policy. Most of our listeners are probably aware that this podcast is a product of the staff at the Takshashila institution. So before we get started with today's episode, I'm going to slip in a word about our courses. We at Takshashila are an independent, non-partisan think tank and a school of public policy. We have education programs that last either for one semester or for a full year. These courses are all online, and you can take them from anywhere. Admissions are now open for our 12-week graduate certification programs in public policy, in defense and foreign affairs, in technology and policy, and in health and life sciences. The application deadline for the September 2021 cohort is the 28th of August. You can visit our website, which is at www.takshashila.org.in/courses to find out more about these programs that we have. All right, on to our episode. By the estimates of the government of India, something like 435,000 Indians have died in the pandemic so far. That's a really grim and awful statistic, but it's actually probably a major underestimate of the actual death toll. And whatever that death toll is, it's probably too grim for us to bear. But as of this recording, the hopeful sign is that India has delivered something like 581 million shots, which cover about 451 million people with at least one dose. That is still less than a quarter of the population. So there's obviously a long way to go, not just to get everybody their first shot, but to get a large portion of India's population fully vaccinated. And what's also going to happen is, as we make progress, you're going to start finding some populations that are especially hard to vaccinate, which brings us to the topic of today's episode, which is vaccine mandates. Should vaccines be mandated in some cases? How do we go about this? Is this a practice that has worked in the past in India or elsewhere? To discuss all this, I have with me Arjun. Welcome to All Things Policy, Arjun. This is your first episode.
Hey Aditya, good to be here.
All right. So, Arjun, you're working on a very interesting document on vaccine mandates, and that document will be out soon. But just to get us started, can you tell us about how vaccine mandates have been working in our present pandemic? Have some countries, some governments actually used them, and have they been effective?
Yeah, so what happened was, especially during the steep rise in the number of COVID-19 infections in the last month across the United States, there was a shortage of beds, and people were not ready to handle the rapid rise. So this actually led to the concept of mandating the vaccine across the country. They saw that the majority of the hospitalizations in the country were among the unvaccinated section of the society. So that is where the whole concept of mandating the vaccine and making it kind of compulsory came into the picture. So, especially in the United States right now, 3 major cities have already enforced a mandate for accessing all sorts of indoor spaces, such as restaurants and gyms. They are New York, New Orleans, and one more, which I've kind of forgotten. But those 3 cities have kind of made it compulsory for people to show that they've got vaccinated to even have access to these indoor spaces. Other than that, the state administrations, because US is a federal country and states are allowed to have their own laws, state administrations have gone ahead and mandated the vaccines for a section of their residents. So especially in California right now, teachers both in public and private schools are required to get vaccinated before they can start their offline classes. So that's in the case of United States. But other than that, there are quite a few countries around the world who have gone ahead with their own mandates. For example, Canada, which has already vaccinated like 60% of its own population, has already issued a mandate for all the travelers by either train or air or ship or whatever. And anyone who's working in the transportation sector must get vaccinated. So, other than that, yeah, there's France and Italy who have also enforced a strict COVID-19 pass. And recently, Sri Lanka came out with its own compulsory vaccine mandate. So, wherein they're starting to enforce it from September 15th, wherein you have to get the vaccine to even have to travel across the country from one province to the other. So that is something which we have not seen right now. And different countries are coming up with their own solutions to tackle the pandemic.
Yeah, it's really interesting to see these mandates come up at the same time as these vaccination drives. It's also interesting to see, for example, Sri Lanka trying to put these impose these travel restrictions, essentially something like a vaccine passport domestically. But Arjun, one thing that I was really interested to read about in the document that you're working on is the history of vaccine mandates. So vaccine mandates are not new, and vaccines have been made compulsory at various times in various countries, both for entire populations and in specific areas. Can you just run us through briefly some of these attempts at vaccine mandates in the past?
Yeah, sure. I mean, vaccine mandates have been there from quite a long period of time, especially in the mid 19th century, wherein the smallpox epidemic, which was sweeping across European states, the death toll was so high that when finally they created the vaccine and they developed it, it was necessary for the population across the continent to get vaccinated as soon as possible. And several states came out with a mandate for getting the smallpox vaccine for all their citizens. And this wasn't just like a section of their citizens or like an age group or anything. So everyone in the country were supposed to get vaccinated against smallpox. And this happened in England in 1853. And the German states also made it compulsory to get the smallpox vaccine in 1874. So what was interesting is that the mortality rate, which was seen like 5 years after the mandate was issued. So in Germany, when they mandated the smallpox vaccine in 74, they kind of took the mortality rate due to smallpox 5 years later, and it was 30 times less than what was observed before the vaccine was mandated. So that was something which was very interesting, which I kind of read when I was writing the document. And similarly, I mean, smallpox was basically the base for vaccine mandates, and this also happened in the United States, especially for school children. Like all the children who wanted to attend these public schools and even private schools after an extent. So it started with the Massachusetts states in the 1850s, which mandated the smallpox vaccine. And by 1900s, the early 1900s, almost all states had adopted the mandate for the smallpox vaccine, and which was very interesting. And half a century later, because it kind of worked, vaccine mandates were expanded to include other diseases. Like in by 1963 or so, 20 states in the US, along with Puerto Rico and District of Columbia, had like laws in place which mandated the vaccines for a variety of diseases. But the thing is, the laws were in place, but the enforcement at that point of time was minimal, and people actually kind of went to court against these vaccines. But like there were certain rulings which upheld the vaccine mandates. This was seen in a 1905 and a 1922 ruling by the US Supreme Court also. So I guess it's kind of seen everywhere, and it has been seen, but it has had its own flaws also.
Yeah, what's really interesting to me here is both that implementation of these mandates is very hard, and that as soon as you try to impose one of these mandates, there is resistance, social legal resistance to these mandates. Can you tell us, Arjun, what would be the legal status of a vaccine mandate in India? We do have some far-reaching laws, Epidemic Disease Act, Disaster Management Act. Are these equipped to deal with the implementation of vaccine mandates?
Yeah, so when, of course, if India ever decides to introduce a vaccine mandate, so they do have certain laws in place. As you mentioned, the Epidemic Diseases Act of 1897. Now, that gives executive powers to the government to prevent a spread of a disease. The Section 2 of the Act gives the right to state governments to introduce any temporary measures to curb the outbreak. Now, a temporary measure is something which cannot be kind of defined. So when states decides to mandate the vaccine, if they decide to do it, they must be in for a legal hassle wherein they might some might argue that inoculation and vaccination is not a temporary measure, and this was actually seen this year itself. Like the state of Meghalaya, they mandated the vaccine for all shopkeepers and road vendors and basically anyone who is conducting their business in public. And a case was filed against the government itself by the High Court. Like the High Court actually went against it and said this cannot be done. I mean, this is a inoculation and vaccination is not a temporary measure, it's a permanent thing, and so that does not hold up. So the Epidemic Diseases Act actually kind of does not give any legal standpoint to the government to introduce its own mandate. Similarly, Section 2A of the same act gives the union government some powers dealing with health crisis. It mainly involves interstate travel and basically usage of public transportation and stuff. So if the government decides to mandate the vaccine as per this act, it would be restricted only to these kind of travel restrictions and interstate travel and stuff like that. So if they decide to mandate it as per this act. But there's also the Disaster Management Act of 2005 that created the National Disaster Management Authority, or the NDMA. The act actually, like the Section 6 of the act, gives the NDMA complete authorization to like formulate any kind of policy to mitigate a disaster. So that also involves issuing guidelines to state governments in drawing up their own plans and stuff like that. So the NDMA actually has legally has the power to formulate a certain policy uh, to issue the mandate. So that is something which we can look at. Similarly, under the same act, Section 35 of the same act actually allows the union government to take certain necessary measures for disaster management. This can involve anything, including coordination with state governments and local governments and all the other non-governmental organizations. So the 2005 Act actually kind of gives some legal standpoint for a vaccine mandate in India. So if the government decides that it is necessary for for a mandate to be issued, especially considering how COVID has impacted our society, they can always look at the 2005 Act through the National Disaster Management Authority. So if they end up doing it, I think it has to be through this one.
All right. Thanks, Arjun. We're going to keep this discussion going, and we're going to get back right after this short break.
Hey, it's been another great week on the IVM Podcast Network. On This Round Is On Me, Shaili Chopra shares with Gauri how they hit 750 million on She the People TV. We have a new show, The Last Brand Standing. Anupam Gupta and Ambi Parmeshwar get together and discuss some of the biggest and most public feuds in Indian brand history. Do check that out. Taste the lip-smacking palette of Karachi with Bilal Hassan on Naan Curry with Sadaf and Archit. On Misconduct, learn all about Dawood Ibrahim's sister Hasina Parker with Ragvi and Nisha. Is the Indian Constitution queer-friendly? Find out on the Longest Constitution podcast with Priya Mirza. And on Audio Gyan, Harish S., design head at Cred, talks about his Carnatic rock band and design as an art form. Do follow us on social media. We're IVM Podcast on Twitter, Facebook, Instagram, and LinkedIn. And remember, if you're enjoying this show or any other show for that matter, please do tell a friend. And finally, we'd like to thank our sponsors on the network this week, Siet, Cred, Bank of Baroda, Quarter, CoinSwitch, Kuber, and Intuit India. Thank you so much for making this possible.
All right, Arjun. But overall, would you say that there is enough legal provision for vaccine mandates to be implemented in India?
It's a gray area because there has been no vaccine mandate ever issued in this country, not even during the British colonial era or even in independent India. So it's the thing
Right.
is, we would not know until it actually happens, and maybe if the case is heard. So that is something we have to still see.
All right. So, Arjun, what you're saying is there is a legal gray area. Implementation is difficult. There could be pushback from citizens, and there could also be potentially some ethical dilemmas coming up with vaccine mandates. So, given all this, how, in your view, can a vaccine mandate be implemented in India? What are the considerations we should take into account?
So yeah, because the thing is, the vaccine mandate is generally covers everyone, right? So what we have been seeing around the world right now, the mandates which are being issued are all blanket ones. Like they majorly cover the majority of the population. So in France and Italy, it basically requires all citizens to get vaccinated to have access to in public indoor spaces like restaurants or bars and cafes and stuff like that. But considering the population of this country and the fact that vaccine hesitancy has always been a kind of issue in India, we should be looking at a mandate which is a targeted one. So we want to recommend something that shouldn't cause some unintended consequences. So if the government comes out and says everyone should get vaccinated, it might lead to some kind of uproar, or even it might lead to some kind of unintended consequences like increasing vaccine hesitancy and a section of the society refusing to get vaccinated. So that might happen. So we do not want that to happen, but majorly protecting whoever is going to be at risk. And the majority of the ones who are going to be at risk is the workforce of this country. So we kind of want a mandate wherein it should be left to the employer institution. It can be a government employee or a private employee or anyone like that. So the government should actually decentralize the power of issuing a vaccine mandate to the local authorities and even the private sector, so that they kind of issue the mandate when it's actually needed. So if a private company wants their like employees to come and work in the office, let's say, they can actually issue the mandate to those employees. So the mandate should cover only them. So it shouldn't be like a blanket one wherein the government goes ahead and says everyone should get vaccinated, and that should be done. So that would lead to some kind of consequences which we do not want. So that's where we are at.
Right. Now, but let's say a private company does want to impose this mandate. There will have to be exceptions. They will have to take some things into consideration, right? So, what are those?
Yeah, definitely. I mean, issuing a mandate is just a very small step. I mean, but the thing is, if they want everyone else to be, everyone under them to be vaccinated, they should provide all the facilities which they need to get vaccinated. So first of all, they should ensure that there is an ample supply of vaccines before even they issue the mandate. So that must be checked first of all before they issue the mandate, in like, so that the vaccines or the stock they have should cover all their employees or all their staff or whatever. And the fact that they should be able to pay for the vaccine. So if you want your employee to be compulsorily vaccinated, you cannot force them. As long as you can you can say that you have to do it and you might have some consequences to face, and I will pay it for you. So you do not have to pay it. So I will do it. So that's why you have to get vaccinated. That time people might actually not like they might actually comply with the mandate. But if you say you have to pay for it, you need to get it on your own and stuff like that, people are generally going to go against the mandate. So they should ensure that there's an adequate supply, and the fact that they should cover the vaccination cost for everyone who is under the mandate. So that is one of them. And the fact that the vaccine has like multiple side effects.
Right.
This has been seen, like, I mean, Covishield and Covaxin have known to have side effects which can render people, they can get ill on the day of the vaccination or the day after they get the vaccine. So they should ensure that a certain leave policy is in place, so that they can, if you're mandating the vaccine, you should also be able to give the leeway to your employees or your staff to say that, look, you can take a couple of days off because we want you to be safe, and that's why the whole vaccine is there for. So they should ensure that that happens, rather than just forcing them to come back to work even though they are affected by the vaccine which is mandated by the company itself. So that is something that they should keep they should keep in mind while mandating the vaccine.
All right. So the obvious point that occurs over here, to me over here is, since most Indians, like you said, work in the informal sector, how do you, is it possible at all, or feasible or desirable to apply some sort of vaccine mandate to those people?
I think it depends on the work they do. It's again, we kind of want the the safety of the employee must be considered, rather than just mandating it for the sake of doing it. So uh, if the employee or if the workers are in a position, or are they are at risk of getting exposed to certain to the virus, and they're in an open space, or they have to deal with a lot of people in their work, or they have to go to certain places where it's like there might be hotspots of the virus. So those kind of workers, we feel that it is necessary for them to get vaccinated, and that must be done through a mandate, rather than just leaving it up to the workers themselves. Because as we've seen, there has been kind of a backtracking by the general public, especially in the rural areas. They do not have access to the vaccines as much as we do, first of all, and some of them are not cannot afford it. So if a vaccine mandate is given, and the mandate covers the cost and the supply, and the basically the whole process is covered by the employer himself, so that at that point of time we might actually increase the vaccine coverage, regardless of if it's the formal or informal sector. So at that point of time, if a vaccine mandate is given, it will be viewed desirably and positively by people who have not had access to it and who have not been able to afford it till now. So I think that makes sense.
All right. So, that does make sense. So clearly, while India can implement vaccine mandates, they should not be sweeping. They should be done with care. The mandate should only be applied to some institutions, people working in some organizations, and so on. That's interesting, Arjun, and we're really looking forward to reading your document on this. Vaccine mandates are a complicated issue, and it requires nuanced thoughts of the sort that you have provided us today. So thank you.
Yes, thank you, Aditya. And before we end, though, I mean, there are certain exemptions which I did not actually mention, but which are kind of very obvious, right? So there might be some people who have like medical issues and might not actually end up responding very positively to a vaccine. So you cannot go ahead and force anyone of that sort to get vaccinated. So there should always be a separate clause for those people who with medical issues, who are not able to get the vaccine anyways, regardless of there's a mandate or not. So that is something that we should focus on, even if there is or there is not a mandate.
Absolutely. Yeah. So we obviously need to ensure that, risks are weighed properly before administering vaccines, making them compulsory for anyone. All right. Thank you so much. And thank you, everybody, for joining us on All Things Policy.
Thanks, Aditya.
If you liked our show, don't forget to check out other interesting podcasts on the IVM network. You can tune into them on the IVM Podcast app, ivmpodcast.com, or wherever you listen to your podcasts. You can also follow IVM on social media. The handle is @IVM Podcasts on Twitter, Facebook, and Instagram. And hey, if you'd like to dive into Takshashila's research on technology, strategy, and economic affairs, check us out at our Twitter handle @TakshashilaINST or our website takshashila.org.in.
Don't you think that if everyone around you is getting smart, you better be smarter? Hey there, I'm the traveling professor Siddharth Deshmukh, and I'm back with season 2 of my podcast to make you smarter. Smarter with Sid. What's this season's focus about? Well, it's about 10-minute nuggets that will make you stand out at work. It's time to go from smart to smarter. Tune in every Tuesday and Thursday and become smarter with Sid.
If you love cricket, listen up. The Edges and Sledges Cricket Podcast is here for you. Hosted by DJ, Varun, and me, Ashwin, we bring a fun, fresh fan's point of view to talking all things cricket. Sometimes it's just the three of us, sometimes we have guests, including current and former international cricketers. For new episodes every week, check out the Edges and Sledges Cricket Podcast on the IVM app, website, or wherever you get your podcasts.